Hi, I'm Zach, and welcome back to Life in the Crapper. I'm in the process of moving, so there's going to be a bit of time between this and the other vlogs. So I just wanted to get this out there because it's stuff that I shot over the summer. It's how to infect yourself with human whipworm and human hookworm. I'll do a video later that goes into greater detail of how the helminths can actually help achieve remission in Crohn's and colitis patients. So hope you guys enjoy. Thanks. Hey guys, I just wanted to show you that the first set of dosing for my helminth therapy has arrived. It comes in this nice little package. It's actually kind of smaller than one would think. And you open it, and another little package, and you open it again. And it comes with these 7 vials. Now what I'm doing is combination therapy, so I will be taking whipworm, which I believe these are, and hookworm. The whipworm will supposedly take up residence in my large intestine, and that should help with the kind of inflammation that I'm experiencing in my colon now. The hookworm will take up residence in my small intestine, and that should sort of have a systemic effect. Some people only do one or the other. Sometimes for Crohn's it works best to do both. Sometimes people suffering from severe allergies will only do the hookworm, and because so much of your immune system and everything is actually in your guts, believe it or not. So it comes in these little vials, so it's not like I'm actually eating worms or something. I'm just going to drink a quick little salty solution, and I'll dose roughly every 6 weeks. My first dose today will be the 100 whipworm ova, and I'll just open that. And you can't see anything. It's completely clear. There's no eggs, there's nothing like that. And what it recommends to do is you drink it, and then you put some more water in it and shake it up a little bit, and then drink it again to make sure you get everything. And that's really all there is to it. When I actually receive the hookworm, I'll show you that in more detail because you actually apply that with a bandage. But it's really simple. It's a little nerve-wracking because the idea of I'm going to drink worms, but ultimately I view it as a safe, natural way that the body's supposed to function, and I would rather have good results come from this rather than being on all sorts of kind of manufactured chemicals that I've been putting into my body. So here's cheers to this journey down the hatch with some worms. Yeah, it's just salty. A little salty. I'll go wash this out now, and we don't have to videotape that, but I'm just going to put some water in here and drink it. Alright, thanks guys. Hi guys, I'm back. I'm going to show you how I infect myself with hookworm. I took the whipworm orally last Friday. Didn't really experience too many side effects because I'm on the anti-inflammatories as is. I would say about 3 days ago I had a little bit of diarrhea. And some fairly intense intestinal cramping, but that was about it. It only lasted for about a day. So about a week after the whipworm showed up, I got the hookworm. And it includes a bandage, and this is different because rather than ingesting it, I'm going to put the solution on the bandage and then apply the bandage to the inside of my arm. And what they're going to do is they're going to migrate into my bloodstream, after which they'll travel to my lung, and then they'll kind of get lodged in the throat, and it'll maybe cause me to cough, after which I kind of swallow, and then they'll travel down the path to my small intestine. So even though I don't have any inflammation in my small intestine, when they take up residence there, a lot of benefits are seen. So the whipworm, kind of large intestine, colon, and that should help me because I have Crohn's colitis, but there also should be benefit from having hookworm in my small intestine. There's a lot of people with allergies and all sorts of other issues that have found relief by doing just the hookworm by itself in the small intestine. But since I have Crohn's, they found that the therapy that works best is the dual therapy, so using both worms. So I have the bandage here, and my hands are clean, and I'm just going to lay it out, and I'm going to include a little pipette, and just this small little package. There's 2 tubes in here, one that's pink and marked and one that's clear. The ova are in here, and I'll use the pipette to take the solution out of here, put on the bandage, and then I'll use this solution as kind of a rinse for the pink one, just to make sure everything's out of there. Now, just a note with the pipette, you should definitely try to make sure you get out, squeeze the bulb so that you get out any air beforehand. It'll just make removing the solution easier. And also, you might want to remove the solution in like 2 halves rather than getting the solution all the way up in this bulb, because then it'll be just more difficult to get it out of the bulb and onto the Band-Aid. So, I mean, because I'm doing this by myself and doing it with my laptop, I'm probably not going to be able to show you guys the best, but I'll tilt it down here and maybe that'll help you guys see what I'm doing. So, it's a hinged cap, so I'm going to open it slowly and control it, making sure no liquid sprays anywhere. If it does, it's supposed to not be that big of a deal, because they say the eggs tend to reside at the bottom. So I'm going to squeeze the bulb, squeezing out air. I take a little bit, fill it up to right about there, and now I'm going to expel it right here in the center. Okay, and do the same thing for the rest. Maybe I'll do it in like thirds. I'll do it in the center. Okay, let's get the last of the solution in here. Okay, making sure it doesn't go up too high. Okay, and I'm going to try and suck up anything that might be left over. Okay, so now I'm going to open this, and I'm going to transfer this solution to here. So it's going to kind of help to make sure I capture everything from over here. And the hookworm does seem to have a little bit less of a shelf life, or not as much shelf life as the whipworm, so you have to use it very soon after receiving it. Now, once I apply this bandage, what it's going to do is probably for the first 20 minutes, maybe an hour, I may get a rash. They say people taking Humira and other anti-inflammatories or even antihistamines may not experience much of anything. It'll be like just a little rash, kind of like a heat rash or something like bug bite possibly at the site where I attach it. It's not supposed to be too drastic or anything, and it's not going to spread to anyone else. It is going to be solely into me, and most should enter the body within an hour or 2 hours. They say leave the bandage on for a minimum of 4, 12 to be safe. I'm going to leave it on for 24 hours just to be super safe. And I'm just going to put this sucker on right here. Nice and firm. As you can see, a little wet spot right here, but nothing seeping out or anything like that. No liquid anywhere else. Perfectly safe. I'm the only one who's going to infect myself. Bandage is going to keep it contained just to me. There's never any danger of anyone else getting this. The worms can't go to anyone else, and yeah, it's a small amount that I'm infecting myself with, so it's never going to create major complications for me. And even if it did, there's a solution you can get from your doctor that will immediately kill the worms. So everything's above board and safe. I'm not infecting myself with Ebola or anything like that. So hopefully I'll be able to get these things online soon. We had a really good acting class today, really good students, and so it's going well. Good summer, full of Macbeth and teaching and acting, and it's going well. So I'll talk to you guys later. Bye.